All right, so thanks again for doing this. My first question to you is, tell me a little bit about yourself and how you got started in the therapy realm.
Yeah, hi Laszlo. It's very nice to meet you and see you. My name is Reka Foster, and I'm a licensed marriage and family therapist. Um, Originally, I started to work as a clinical psychologist. That's my original academic background. And I have to say that in the past about 20 years, the field of psychotherapy and different techniques, how to reach different demographics and different people, um, just exponentially grew. So I started to work at a mental health clinic, and I have to say, I might have seen hundreds of people, if not more, um, with different mental health issues. And because of the number of people I've seen, um, a smaller portion of these people had also physical disabilities as well. Um, that brought up kind of like a different question of how to be happy with um, visual vulnerabilities in a way. So I'm not sure, but probably since you're on this field, um, you know that about 16% of the people, the global population, um, has some sort of disabilities. So that's a huge number. So it's almost like more than like one or two people from 10 have some sort of disabilities. This number is a little bit lower in the United States. It's about 13%. And statistically, more women end up having some sort of disabilities than men. Um, so it is such a huge population. Um, in my private practice, I also have a private practice. I'm also in a group practice, um, treating people, and I'm more focused on couples therapy and sex therapy with people. And it's not more about the vulnerabilities can be that we're not really sure about what we want. We are having a lot of fears, traumas that we don't know how to handle. And all that makes the openness and curiosity and confidence toward social interactions um, much more difficult.
Mm-hmm. Yeah. My next
Mhm.
question is, tell me a little bit about the work that you currently do. I know you explained that a little bit, but could you like explain some of the things that you do in your current role?
Yeah, so currently I'm more focused on couples, and we're doing something called EFT. This is emotion focused therapy, which can be done individually as well. Um, I'm also treating families with larger groups when there's family dynamics are dysfunctional. So correcting that and correcting communication and basically trust um, between family members. So it's a
Mm-hmm.
more couple focused situation. However, couples therapy can work on an individual level as well because sometimes we're alone. However, we want to address how to date, how to reach out to other people, um, how to kind of like break through this fear. Sometimes the biggest block in um, finding a satisfying relationship is our own fear. And that is highlighted with disability because um, I wouldn't say there's stigma with it, but the fear of um, disappointment, the fear of being taken advantage of, um, can really close people in in a way, loneliness and giving up, that, well, I cannot be happy. However, everybody wants to be happy and everyone wants to be loved. It doesn't really matter um, how what type of abilities we have, you know. It's um it's a question of planning, detailed planning, and um, a thorough self-knowledge. There's one trick I like to advise to my clients um, who don't really know how to handle the initial contact, and that is that you need to create um, a little narrative. Maybe you can even write it down. You need to create a little narrative about your own disability to get through that initial fear. So that narrative can be like an automatic, like, oh, how are you level. Because when we say hi, how are you? We totally have neutral feelings. It's not a stressful statement. And quite frankly, in most times, people don't even care about how you are. We're just asking people. I'm from Hungary, so it's American. Um, Extremely happy. Everything is so good. That was a little bit strange for me. So it's kind of like the goal is to create a narrative that um, that is clear, short, understandable for people, and completely neutral. So you're kind of like eliminating that initial block of, all right, how to talk about it. However, it's possible to create relationships when you don't even really have to talk about it. I had many clients who had online relationships, maybe overseas, some of international dating, and there's a few. Thank God, there's few good websites for people who just really want to kind of like, they don't want to go through on this initial conversation and revelation of, hey, by the way, I need special accommodations. I would need something else, or I want to bring up something that um, that you might say no to. So there are websites like Dateability or Special Bridge are good websites that it's you're not going to need big explanation because it's already known by people who are going to these sites. But yes, there are options of creating online relationships, chats, conversations, even romantic feelings. And one of my clients had a girlfriend overseas um, in England, and they had such a lovely online relationship. And basically, the anticipation to plan for a meeting, sometimes it can be even more fun and adventurous. That have feeling that all right, I'm preparing myself. It's the trip is going to come, um, which is basically, I mean, it's not unique to disability. This is how it is.
Mm-hmm.
We really People can really appreciate this anticipation. Mhm.
Yeah. My next question is, what sorts of methods or approaches do you use, when working with clients?
You know, I could say a different treatment methods um, which are recommended, which is CBT, cognitive behavioral therapy, that is really focused on behavioral changes. So it's this is kind of like CBT is a common sense therapy that if something doesn't work this way, try another way or find another way how it works. If if you can't reach the top shelf, then find a way how you can reach that top shelf because there can be, maybe you just haven't thought about it. Um, I mean, with disability, I think occupational therapy comes up, but I'm not an occupational therapist. I'm more working with the soul and emotions and that internal balance. Um, the challenge is because you might need to think that if something is not working right in your life, the question is what's out of balance in my body and in my mind. And with disability, initially the feeling is there that yeah, I'm not in balance. My body is not functioning how I want it to function. Um, if you are not in debilitating pain all the time, the goal needs to be very future oriented. That I'm doing what's comfortable for me. And that's it. Everyone's doing what's comfortable for them. Um, so the technique is more about, therapy is connecting with another person. And in that connection, you are discovering yourself. That's how we were designed. And that's why it's finding a partner or more partners, depending on the preferences, is so important for everyone to feel a full, balanced life. Um, and it has to start with soul searching, with your
Mm-hmm.
own, what do you really want? So it's sometimes depending on, because disability can create these things like very deep depression and anxiety and disappointment. And if I'm depression is though just a symptom, right? Depression is the symptom of I have no clue what to do. I don't like this at all. So, but it is like a quicksand, so it pulls you in. So many times, treating depression is something that's necessary to let people find their real self and accept and finding ways how they can be comfortable.
Mm-hmm.
Therapy is not for telling people what they should do.
Yeah.
Therapy is for people to find what they really want to do and embrace those emotions.
Mm-hmm. My next question is, what have you heard from people about their experiences, with, therapy and your kind of work? In other words, like what have, clients told you, like, do they say like I've come to work with you and this has helped me in such and such ways? What has the feedback been like from your patients, visiting you and getting, you know, counseling and stuff?
Mhm. I would say it's um, it's a very difficult journey. I noticed that sometimes when um, when something exponentially changes in people's life, and it's not necessarily about with dating, but maybe finding a part-time job, starting to have a hobby, um, that helps people to gain a little bit more confidence. And when you get that, you have to ride that wave. So I think it seems to be a good opportunity to start and look for and initiate conversations with others.
Mm-hmm. I guess my last question in all of this to wrap this up is what can people take away from this conversation? How can sort of counseling help people navigate the various challenges that people face? Because there will be people who find counseling very helpful, but
Mhm.
others not so much. So what advice would you give, people who are aiming to seek help for, whatever struggles circumstances they need.
I would tell them to um, think about what's comfortable for them, and that is number one. It You have to adopt to that mindset that I dare to find what's comfortable for me. Even I dare to explore my body, what feels good to me, and I can acknowledge those, and I dare to fantasize and um, initiate conversations with people. It shouldn't be. I mean, the fear is something what people need to debunk here.
Mm-hmm. Yeah, it's a moment of self-discovery, rediscovery and just kind of finding yourself and all that kind of stuff.
Mm-hmm. Mm-hmm.
Yeah, I know I don't have this on my set of questions, but what can other upcoming professionals in the counseling field and others, what can they sort of I guess what advice would you give them, if they want to pursue a career like this?
You mean counselors who are planning to work with this population? Um,
Just like in general, um, and that too. Mm-hmm.
I I would just say that it doesn't really matter for others whether you have disability or not. People are people and bodies are bodies. Um, so I think some therapists who do not have experience with people with disabilities, um, it is a therapist's personal choice if they find themselves capable to work with this population, because you really have to have a deep insight and empathy uh, to understand and connect. So it's not necessarily their therapist's personal understanding is important, but it's the ability to connect, because without that connection, you cannot um, meaning you cannot be in a flow with a client. I usually say that it's almost like working with someone is like you are sitting on that person's boss, and it's their boss. I'm just there, and I can give some guidance because I see maybe from a different perspective things, but it's their boss.
Mm-hmm. Yep, that's pretty good advice.